device, and I've given this talk in many, many places around the country, called the Curious Eye. If I'm talking to doctors in general, I call it medicine and visual arts. If I'm talking to dermatologists, it's, of course, dermatology and visual arts. And to start off with, I want to just emphasize that art and medicine have a lot of similarities. And the function of an art historian or curator, for example, can be very similar to a physician. For example, an art historian, when they look at a painting, they're going to take several steps: observation, description, analysis, and resolution. So the first thing you do is you look at the painting. The next thing you do is describe it. Then you analyze it, and you think about it, and you come up with a resolution so that you can talk about things like what did the painting mean, talk about the technical aspects of the painting, etc. Now, this is very similar to what a physician would do. In terms of clinical diagnosis, as a dermatologist, for example, the first thing I'm going to do is look at the disease or the disorder. Then I'm going to describe it. Then I'm going to come up with a differential diagnosis, and as you probably know, that's a list of possible diagnoses. And finally, after perhaps doing some tests or some analyses, you come up with a diagnosis. Very, very similar to the steps that an art historian would go through in analyzing a work of art. Another area where art and medicine intersect very favorably and very positively is in terms of the history of medicine. There are great depictions of critical moments in the history of medicine. For example, Hippocrates. This is a 12th century painting on parchment, a Byzantine painting, illustrating an edition of Hippocrates' aphorisms. Hippocrates, he was well before Osler. He had a lot of aphorisms and some great things to say. And perhaps the best of all, every doctor should say this to themselves every day before they go into work: primum non nocere, first do no harm. Galen, a prominent figure in the history of medicine who dominated medical thought for 12 centuries. Even think about anybody today dominating medical thought for 12 years, let alone 12 centuries. Paracelsus was a transitional figure, 1 foot in the Renaissance, 1 foot still in the Middle Ages. And then a very, very important man in the history of medicine, the Renaissance anatomist Andres Vesalius. He is pictured here as one of several historical medical figures in a mural by the Mexican muralist Diego Rivera. So what did Vesalius do that was so important? He basically helped end the dominance of Galen thought and Galenical thought and humanism. He was the first person to really effectively dissect the human body and then demonstrate the human body. And this is where the art comes in. He published a book in 1543 called De Humani Corporis Fabrica, which is one of the most important books in the history of medicine. And again, not only did he have great dissections, but he had beautiful artistic representations. He wasn't an artist himself, but he outsourced that to some really great artists who came up with these images. Now, one of my roles over the medical center, I'm the president of the Friends of the TNC Library. And I will tell you that in the TNC Library, in the Rare Book Room, we have an original edition of De Humani. And it was actually purchased for the library by the Friends of the Texas Medical Center Library. When we purchased it, it was for $30,000. It's been recently evaluated at $350,000, so I should have bought it for myself. But I didn't have $30,000 lying around right then. So moving on, I'm going to show you 2 images from a book called Fasciculus Medicinae, which was published first in 1492, so it was an incunabula. Then it was later published in 1514. So these are Renaissance images. So if you look at this image, it's called the Zodiac Man. And so it shows that even at the time of the Renaissance, physicians were relying on the occult and zodiac images. At the same time, in the same book, you have something called the Wound Man. So you see that even though they were still influenced by the zodiac, they also were very realistic and practical about dealing with things like wounds. And sometimes I have described this as being a tourist who tried to walk through Central Park at night. Now, I'm going to show you 4 images of anatomy lessons, because this is an area where, had profound influence on thinking of individuals. So if you did die, then you would be dissected, but only very late, only when you were approaching the Renaissance. Remember when Galen published detailed anatomical drawings and descriptions without ever dissecting the human being. He dissected animals, and so he came up with some very good findings and some that were totally wrong. So when you first started dissecting human bodies, it was really an adventure. It was dangerous. It was against the law. You could be thrown in jail. You could even be killed for that. Now, later, it was not quite so dangerous. This is a painting by Rembrandt, 1632, the anatomy lesson of Dr. Tope. And I see these images, these faces staring intently. It looks like a group of dermatologists learning how to inject botox. This one I really like. It's called The Rewards of Cruelty, and it's by Gerard David in the 16th century. And it's another example of a dissection. But what I like is that it makes you stop and think for a minute. When we talk about art and medicine, and we're making all these historical analyses and things, that the real reason we're looking at art is because it's art, because we like it and it speaks to us, just as the Pietà spoke to you. You look at this painting and you look at the use of the color red. Red, crimson, scarlet figures, and it all brings you back to Central Park. Okay, now I'm going to talk a little bit about a lesson, the terrible diseases generate powerful emotions and powerful art. We're going to talk first about plague. Often when you think about plague, people use the term the plague. And I don't know how much medical history you know or if you've studied it. There was not a plague. There were dozens of plagues over many years. Between 1347 and 1750, there were 10 plagues. One of them is what people call the plague, that is the Black Death of 1347 to 1351. That's where at least a third of the population of Europe was destroyed and killed off, and led to everything from the Protestant Reformation to the Renaissance. There were other great plagues, like the Great Plague of London in 1665, etc. And in terms of art, again, I say powerful, terrible diseases generate powerful emotions and powerful art. This was an engraving, first to say when the plague would hit, a third of the population of Europe died, but in any given village, many examples of 90% of the population of the village being wiped out by this disease. And this gives you a feeling of what it might have been like. Death, riding some winged creature, sweeping through the streets of the village, and you see what's happening. People dying, falling dead as he sweeps through. Very powerful image, but very realistic image in cases where 90% of some villages were being destroyed. This is a painting by Peter Bruegel the Elder. I was a pupil of Hieronymus Bosch. When I asked people, who do you think this is, the artist, most people guess Bosch. It looks a lot like Bosch. And if you want to see the comparison, this is in the Prado. And it used to hang very close by one of Bosch's most famous works called The Garden of Earthly Delights. And there you see, the dramatic difference between the Garden of Earthly Delights and basically hell on earth. This has been described as just representing war or death or famine, and some people suggest, because of the timing, in the middle of the 16th century, that it was influenced by the plague. And this is an image from the German National Museum in Nuremberg. This was from the middle of the 17th century, around 1656, as I recall. The figure I remember because this is what the plague doctors looked like. They wore long capes like this, long gowns. They wore gloves. They had a stick to kind of ward off people. They had a hat. And then they had this beak-like mask. And if any of you have visited Venice, for example, or Florence, you see people selling images or reproductions of these masks. I bought one in Venice many years ago. And interestingly, what do you think the beak, why is there a beak there? Yes?
They were put in like flowers and stuff.
right. And it was actually, there were two reasons they put in there, the herbs and flowers and things. One was to disguise the odor of death, which would have been powerful in some of those villages. The other is because they actually thought it might help prevent the disease. Because remember, at that time, nobody knew what caused any of these diseases. So, but you're absolutely right. And so this is it's a powerful image of what the plague doctors would have looked like. And again, how desperate the times were. This is a quotation from the time of the Black Death. When these things happen, all friends desert us, and a man is alone, a stranger to the breath of his own relations, isolated, totally isolated from society. Then, I like to toss in a little history, a little literature, a little art in all of my lectures. I've got enough gray hair now I can indulge myself in my humanities interest. This is what I call the literature of despair. So if you want to read about the plague, of course, you might start with the Decameron, where a group of nobles, I forget how many young men and women, left the plague of Florence, went into the hills, and then sat around telling stories. And that's what the Boccaccio was all about. In the Journal of the Plague Years, this was, Defoe wrote this in 1722, but it was about the plague of London in 1665 that I mentioned earlier. Samuel Pepys wrote about the plague of 1661. Camus, in La Peste or the Plague, was writing about a plague that took place in Algeria in the 1940s. So again, to realize plagues have spread across almost all of human history. Today we see plague in the United States. People still die from it in New Mexico or Arizona, but we don't see massive plagues. Ring Around the Rosie, if you haven't heard, is an interesting story. You remember the nursery rhyme, ring around the rosy, pocket full of posies, ashes to ashes, all fall down. And it has been suggested that this originated from the time of the plague. So it's ring around the rosy is a red ring around the lesions of bubonic plague. Ring around the rosy, pocket full of posies is the flowers again, to conceal the odor. Ashes to ashes is burning the bodies of the dead. And all fall down. When you see the children play out that ritual, they're dying. They're playing out the ritual of death at the very end. Okay, another disease, powerful disease in history, dramatic impact on medical history, smallpox. This is a great image of smallpox, and images like this not only kind of show us what the disease looks like, but what it looked like, and it's an example of how art can help historically define the existence of diseases at a particular time. If this is accurate, this comes from the Chow Dynasty, 12th century BC. That is about 6 centuries earlier than the traditional belief that smallpox originated in the 6th century BC in the Sung Dynasty. So art can be very valuable as contrasted just with the written record. Now, this is one example of the enormous impact of smallpox on history. This is, have any of you been here? This is Teotihuacan, the pyramids right outside of Mexico City. If you haven't been, you should go. This is a picture from the Pyramid of the Sun down the Avenue of the Dead to the Pyramid of the Moon. When I was a young guy with dark hair, I climbed up there myself and took pictures. Now I send residents or students up there, or maybe pre-med some rice, to take the pictures for me. So why am I showing you Teotihuacan? Remember, I have a very strong interest in pre-Columbian art, and I collect pre-Columbian art. And there were incredible civilizations and empires in Mexico, Central and South America before the Spanish arrived. When Hernan Cortez arrived in Mexico in 1518, he had 800 men. The population of Mexico was 30 million. The population of Tenochtitlan, the capital alone, was 300,000. They conquered Mexico. How do you conquer a population like that with 800 men? And one of the answers suggested by historians such as William McNeill and others is smallpox, because the Europeans were largely immune to it. They brought it with them. The Amerindians had no resistance whatsoever. So when they finally marched into Tenochtitlan, about half of the population was dead and many of the others were dying. So smallpox has changed civilization and history many times and in many ways. And of course, art does pop up. This is an engraving from the time of the Spanish conquest, showing people being brought out, dead bodies being brought out of the houses, placed in these boats, taking down the river to be buried. This smoke here is believed to be, burning the body. So this is an image of the end, really, of the Amerindian empires. So T.S. Eliot said it well, what we call the beginning is often the end, and to make an end is to make a beginning. The end is where we start from. So the end of the Amerindian civilizations was the beginning of the Spanish conquest of Mexico. Now, a few skin diseases. To start off with, this doesn't look like a skin disease, but it's very strongly related to skin disease. Not that. It's funny when you get two images here, you get a little ahead or behind yourself. This is a painting of baths from the 16th century by Hans Bach the Elder. And if you take a close look, there's a lot more going on there than just bathing. And so this illustrates that the baths in the Middle Ages were one of the major sources of the dissemination of syphilis. Just like the baths in New York City and San Francisco, even today, are a source of that, and were a source of the spread in the early days, particularly of AIDS. So a little bit about syphilis. You heard the lecture about Osler, I hope. It was a very nice lecture. Here's a quotation from Osler. He who knows syphilis knows medicine. Nowadays, we don't see a lot of syphilis, quite frankly. But I find it very interesting to see how the impact of diseases on history and on individuals. These are just some of the suggested victims of the Great Pox. These are authors. A lot of it is speculative. Pretty good evidence for Oscar Wilde, James Joyce. Excellent evidence for Flaubert. He described himself black saliva and losing his teeth while he was treating himself with mercury. And syphilis was virtually de rigueur for the French symbolist poets like Baudelaire, Daudet, and Rimbaud. So many of these people did live with and die with syphilis. Now, other victims included musicians, painters, other artists. And I would just focus for a minute on Goya. So I'm going to show you a couple of images by Goya later. Goya was believed to have had syphilis and believed to have died of neurosyphilis. Now, this is an image, one of his engravings, called The Sleep of Reason Produces Monsters. It's in the, I think this is in the Prado too. It's engraved about 1797, and it looks like a very good image of what somebody with neurosyphilis might feel like and might be thinking about. This came from a group of his etchings in tints, aqua tints called Los Capricios, sometimes referred to as his mad period. Now, so the lesson here is epidemic diseases have deprived us of many great artists. And while I'm thinking about it, I'm going to go on to another disease in a minute. You've already seen a couple of references to the impact of art, several actually, during this morning and afternoon. Like Pietà is a great example, illustration of suffering and grief. And then the Van Gogh painting that was shown of Wheat Field with Crows. That, in case you didn't know it, that was the last painting that he completed. He was working on another type of painting, but the last painting he completed before he died. So when you see those dark black birds rising out or hovering above those yellow fields, might give you a little bit of feeling about what's going through his mind and his psyche just before he shot himself. So leprosy. Now, there are very few more dramatic and emotionally traumatic diseases in history than leprosy. It's a very important disease for me. This is why I'm a dermatologist today. I was going to be an oncologist. I was doing a medical internship at Cornell. I was going to oncology. And that's why I talked about burnout. And you heard, it was interested when you were talking about the impact of these professions. And at that time, oncology was a brutal specialty, not like today at MD Anderson, but it was a brutal specialty, very few effective drugs, horrible side effects of those drugs. And probably the most awful influence was walking on the wards and seeing the children with these x-ray ports. So I decided, nope, not oncology. So instead of going to the NIH and going into oncology, I went in the Peace Corps for 2 years. I was a Peace Corps doctor in the Marshall Islands in Micronesia. I sailed around on boats to these remote coral atolls, and I was helping run an epidemiology program with the University of Hawaii. And one of the diseases we were investigating was leprosy. So I was introduced to leprosy, was treating fungal diseases, and discovered dermatology. And it's interesting how we back into some of our career choices, and just by accident, I found the perfect choice for me, because I'm very visually oriented, and I have a short attention span. And so I don't want to spend, you get the luxury of spending an hour and a half or 2 hours with a patient. I don't have the luxury even if I want it. We spend 10 minutes with a patient, and that fits people with ADD like me a little bit better. Before I went overseas, though, we trained on the island of Molokai. Have any of you ever been on Molokai? At least maybe a couple of people here. I like to toss in a little touristic recommendation occasionally too. I've been on all the Hawaiian islands several times, except Niihau. You have to be a native Hawaiian to go there. But Molokai is the most interesting one to me because it is the most remote and the most like old Hawaii. I don't mean 16th century Hawaii, but older Hawaii. Just as an example, the last time I was there, it was a few years ago, there was only one traffic light on the island in the town of Kanakakai, and it didn't work. That's it in perspective. So this is Molokai. This is the peninsula of Kalapapa. Perhaps you've heard that name. It's famous for the leper colony. Leper is an opprobrium, for anybody with Hansen's disease. They don't want to be called a leper. They want to say they're victims of Hansen's disease. But historically, sometimes you have to use words that aren't popular words, and that's what they call it. It's called the leper colony, and I'll show you why in a minute and how. But the original location of the colony was over here, where Father Damien worked and died, and this was the leprosarium that was developed later on. It was a great place to isolate people, because these sea cliffs here, one of the things I did in the Peace Corps was basically memorize the Guinness Book of World Records. And the Guinness Book of World Records says that the sea cliffs of Molokai, about 2,000 feet, are the highest in the world. So nobody could climb up there. There were no airplanes or boats coming in. If you tried to swim, this area between Molokai and Maui and Lanai, this body of water is often known as the Tokyo Express. So you get out there, next stop, Japan. So here's another view. So I was hiking down to Kalapapa and showing the actual leprosarium. Now, today that leprosarium is closed, as is the one in Carville in the United States. Nowadays, we can treat leprosy very effectively, and so we don't isolate or incarcerate people. But this, unfortunately, this is a beautiful area. I can show you some gorgeous pictures, particularly over here. But it's been protected. It's now going to be, I think it's a state park, not a national park. Hopefully no high-rise condos. You can see pretty nice beaches right here. But they still allow maybe 50 or 60 patients to live there. And that's because they have nowhere to go. And once they die, it will be totally closed. This is how it all began. 1865, the end of the Civil War, there was an act to prevent the spread of leprosy passed in Hawaii. People suspected of having leprosy were rounded up, taken to the Kali'i Hospital in Honolulu, then transferred over to Kalalau. That was the valley on the far side of that peninsula where I said the original leper colony was located. And then you have famous Father Damien, and here's that word again, the leper priest. He was born in 1840, went to Kalapapa in 1873, and died in 1889 of leprosy and probably tuberculosis on the island. Interestingly, he was buried in Kalapapa. I didn't include a picture, but I've got a picture of his gravesite and absolutely stunningly beautiful view. But the Belgians came in and unburied him and took him back to Belgium and buried him and made him a saint. I'd rather just spend paradise right there in Molokai. Now, today I mentioned leprosy is a well-controlled disease. We have excellent treatments for it. We didn't used to have such great treatments. This is what it can do. Crippling disorder is another one. can cause blindness. And I spent 4 months in Mexico studying tropical dermatology during my residency at UCSF. After this, you can see that this was a disease that could destroy the body and the soul. So it's a horrible, horrible disease. And so you can imagine, back in the Middle Ages and before, when there were no treatments whatsoever, what a frightening disease this could be. From the book of Leviticus, a man infected with leprosy must wear his clothing torn and his hair disordered. He must shield his upper lip and cry, unclean, unclean. As long as the disease lasts, he must be unclean, and therefore he must live apart. He must live outside the camps. This is an example of isolating and segregating patients with leprosy, and it's been going on for a long time. In the Middle Ages, they actually had laws passed to incorporate that. You had Kalapapa and you had Carville in the United States. These are all closed, fortunately. Now, what about art? Are there good artistic? You'd expect there to be some good artistic images of the disease that powerful and that frightening. This is a picture depicting Job suffering from supposedly leprosy. This is a 12th century miniature, and it's really excellent. This is what's called a Lazar house, or was called a Lazar house. It was a sanctuary for people with leprosy. And you see these two people approaching. It tells us a lot about the disease. People with leprosy, you can kind of see some spots on his face. They had to carry either a wooden clapper or a bell, ring a bell, to alert people that they were coming. They also had to carry an alms bowl to beg for food or money because they weren't allowed to have jobs or to really own possessions. And then back here you see an illustration of the crippling aspect of the disease. So this is excellent from the 12th century. Also from the 12th century, this is a mosaic from the Cathedral of Monreale near Palermo. You see the lepers over here with the spots. And remember, leprosy was believed to be an unclean disease. It was believed to be, the victims were believed to have made some transgression, religious or moral or ethical. And so that they could only be cured really by curing and correcting that moral imperfection. And so here you have Christ reaching out to touch and cure them. 12th century again. Now this is not leprosy. This is severe psoriasis or SIBO psoriasis. And this is most likely severe SIBO psoriasis or possibly a fungal disease called Phagus. But this boy is about to be entered into a leper hospital. The title down here would be The Governors of the Leper Hospital of Amsterdam. So the father is presenting the boy, almost certainly, look on their faces, they're going to diagnose him totally inappropriately with leprosy, where he would spend the rest of his life in that hospital. Horrible disease. Just a quick word about biblical leprosy. Everybody talks about biblical leprosy. There are descriptions in Leviticus of something called sarat, which really means ritual uncleanliness. It's not leprosy. In the 3rd century BC, that Hebrew word, was translated to the Greek word lepra, which meant scaly skin disorders. So then retroactively, people assumed and decided that in biblical times you had leprosy. That almost certainly was not the case. And this will show you, again, the potential value of art and making retrospective historical diagnoses and correcting written records. This is in my collection. I bought this in London years ago, and you can see immediately it's a very nice illustration of a skin disease. You see little tumors on the body. You see a massive tumor here. You see a crippling effect on this individual. Off the screen down here, the title is La Lepra et Elephantiasis. This was from a voyage through the Marianas Islands in the 17th century. You would read, if there had been remember before cameras, all of the voyages of exploration had artists on board to draw and paint what they saw. If this had just been a written record, you would assume that leprosy and elephantiasis existed in the Marianas Islands at that time. They did not. So this is actually a disease called neurofibromatosis, or called Recklinghausen's disease. So language can conceal as well as reveal. Show you a couple of goyas getting near the end here. I love Goya because he painted reality. He painted patients as he saw, not patients, but characters as he saw them. This is called La Boda, or the wedding party. You see this, the rich, affluent people over here, and then these poor street urchins. And you look at the back of the head, and you see what is probably a fungal disease of the scalp that has caused the loss of hair. And so this illustrates pretty well and accurately how fungal diseases like that are more common in the poor than in the rich. But the rich also had their diseases. This is Goya painting the Spanish royal family around 1800. This is King Charles IV. And this is the Infanta, Maria Josefa. And if you look at her, you see a couple of things. She was unhappy with the Trump outcome of the election. And she had this very dark black tumor on her temple. Now that tumor could represent either a totally benign growth called a seborrheic keratosis or a melanoma. Now, historically, you can't really go back and tell, but the woman was 56 years old, once you get a bit older, 56 years old when this was painted, and she was dead 6 months later. This probably was a melanoma. Seborrheic keratosis is going to kill you quickly. Two noses. You've heard of a disease called rosacea. I had it, English ancestry, and it gives you a red nose and red cheeks. And very rarely it will cause something called rhinophyma, a big bulbous nose. You remember pictures of W.C. Fields, the actor, he had rhinophyma. And he drank it. And so often people associate those two together. Not necessarily true. This is the pre-Columbian head showing rhinophyma. And this shows you rhinophyma painted by a Renaissance Grand Master. This is a painting of Domenico Ghirlandaio, middle of the 15th century. He was a teacher of Michelangelo, so he was one of the top painters of his day. And he's a great example of rhinophyma. And the last image we'll take before going home, this is called The Death of Marat. And remember, Marat, Jean-Paul Marat, was a doctor who became a revolutionary, incendiary journalist and propagandist for the revolution, and ultimately died in his tub. He was stabbed to death in 1793. You see the knife down here in his tub. The painter was Jacques-Louis David. It's a great painting. It's a great painting. Hangs in the Royal Museum of Fine Art in Brussels. It's a great painting, but it also was a powerful instrument against the revolution. He used this to depict, the end of the revolution. But dermatologically, what's interesting is he, historically, he more or less lived in that tub of water with herbs and salts and things in it. Look, his head is wrapped up, his body was wrapped in things. He had his little desk so he could write his